Then there is the phase 2 liver toxic detox. There often is polymorphisms in there. I mentioned before the glutathione S transferase. There's 3 different ones that we can test for right now. Very, very common. One of them is completely missing. At least one more has a polymorphism. So out of like 6 possibilities of making glutathione, there's only 3 left altogether, or 2. And so we know this kid is going to be deficient with that mechanism. The apolipoprotein E I mentioned before, very often they have the E4 subtype, or E3 and E4. You know, one allele has the 3, one has the 4. And so we know they're not making a functional apolipoprotein E. There's defects in the acetylation, very, very common and very much so talked about is the methylation deficits. That's sort of like one that I think Amy talks about a lot. I do not know that I can honestly say in my experience that is more common than the others. It just she seems to have picked one of them for whatever reason that she likes to highlight, but I think the other ones are just as important. So when you have a kid that has these toxic exposures that we talked about and does not make good detox enzymes, it's going to bioaccumulate faster than a kid who has healthy genes. There's no question about that. So this kid with the defunct chromosomes should never be vaccinated, should live in a clean home, should be on a good diet, only organic food, and blah, blah, blah. That means it's going to be a more expensive kid to have. However, when you get this kid through the teenage years, successfully, the time when the nervous system develops, you've protected these kids from the onslaught of neurotoxins. These kids are going to have a completely normal life later on. Yeah? And so the sad thing is, in a way, that we now have the technology where at birth, at least, we could test the baby for its genes. No, yes, this is a vulnerable kid. No amalgam fillings in this kid, no vaccines in this kid, no inorganic food in this kid, no carpet floors in the house. Yeah? And then we're fine. We have the solution already, yeah, to prevent these things, and we're not using it. The test is $400, and we're not using it in that way. And that makes me sad, you know, that we have the capabilities now of predicting much of this, and we're not using it.
Just really quickly on the genetic thing, I know there's a lot of speculation that there's been this huge genetic mutation that's happened that's accounted for all of these kids, but don't you feel like these kids' genetic presentation is actually very similar to what their parents was? They just have been so much more salted.
I can maybe answer the question even from another side. I do a lot of genetic testing in the last few years, and we do it primarily on our grown-up population, because they tend to be the people that have the money and don't mind spending $400 on the test. So I have a lot of people with Parkinson's, MS, ALS, seizure disorders, grown-ups, 60, 70-year-old men, people with Alzheimer's disease. And it's clear that these neurological diseases in older age are clearly an outcome of having bad genes. You know, these are the people that have the same toxic exposures over a lifetime that we all have, or other people that are healthy in the mid-70s. But the people that get Parkinson's are the ones that had the methylation defect. They had the glutathione S transferase defect. They lived with that all their life, but because of that, their bioaccumulation of toxins was like this, whereas in the other group it's only like this. Yeah?
And whereas with our kids, that all happened in the first 2 years of life.
And with the kids, on the only other vulnerable period of life is the very first 2 years. And it used to be that the exposures in that age group were minimal before the environment got destroyed. And now it's massive. And so now we see these damages that we used to see in 60, 70-year-olds, we see now in the newborns, because they're coming into this. And it's this is not a theory, you know, when you look at the literature, so it's full of it. And if you ever spend a few days with me in practice, you see these things walking in. Any Parkinson patient that we had so far has a glutathione defect, they have the acetylation defect. They have the same, in fact, they have the same effects, the same defects that we see in our autistic kids, plus they have Lyme disease. plus they have brucellosis, so Parkinson's. I can now pretty much pattern. They have a few herpes viruses, they have this infection, that infection, they have a few genetic defects, they have iron and mercury deposits in the brain, and manganese. That's it. That makes Parkinson. That mix of things, makes Parkinson.
Are you finding the iron in these kids as well? Because I know Dr. Gordon documented the acquired hemochromatosis in like a third of these kids.
Yeah. Well, I think the iron accumulation is secondary to a blockage of the iron processing enzymes by mercury.
Okay.
Yeah. So mercury is again the kingpin, even in the iron accumulation. So I'm not saying this is the only thing we're looking at in these kids, but I think for the purpose of what we're doing here, it's very important to know for moms that in a way the decision is already made in the moment the child is conceived. Is it going to be an accumulator or is it going to be a detoxer? That decision is made in the moment the sperm and the egg get together. And then we have these 7 factors that we're discussing now that will decide, whether the accumulation of toxins is going to be accelerated or decelerated. So the 7 factors that I like to discuss is, one is toxins, which we discussed already. So simply the amount of toxins coming in determine some of the outcome. The second one is nutritional deficiencies. So we know if a mother eats only pasta, breakfast, lunch, and dinner, that the child has a much higher chance of developing autism than we have a child who spends the morning in the health food store, lunchtime and afternoon, starting the morning with a vegetable juice, with a freshly made organic vegetable juice, and then has a nice vegetable-rich lunch, a high-protein diet, a nice piece of meat, organic meat, and so nutritional deficiencies are the second important factor. Then there is no clear numbering system. So number 3, I'd like to discuss the psycho-emotional issues. What we found important in families is simply the stress level in a family. There's families that have a pretty relaxed family culture, and others is a high-intensity stress culture. Under stress, our detox mechanisms are shut off. It's very simple to understand. If a tiger came into the door right now, none of us would be preoccupied with peeing or pooping right now, or burping, or making love with each other. We would mobilize our forces, or how the hell can we get out of here? And the excretion mechanisms are part of our detoxification system. So if a tiger comes in the door, also the enzymes in the brain stop working that are busy with shuttling mercury out of the brain cells. Everything switches on. How can we survive the situation? And if a child is maintained in a high stress environment at home, the detox system shut down. So now what the psycho-emotional causes are for that, I don't think we want to go into that. The whole family systems issues come in here: transgenerational trauma, early childhood trauma, trauma of the parents. Usually childhood high stress levels in the home means that one of the parents has endured an early childhood trauma or ongoing trauma, which would be a class 2 trauma, or has been in a war or some other situation which is a class 3 trauma, has been highly traumatized, and then unhealed trauma creates this stress, the anger outbreaks and the unpredictable behavior in the home that traumatized people have. They're not bad people, they're just traumatized. And so in that atmosphere, the child cannot detoxify. The next factor is geopathic and electromagnetic stress that disables the molecular pumps that are responsible for detoxing, and we talked about that. Then one that's very, very often forgotten is the structural problems in a person. And I need to explain that just briefly. I went into that earlier, that the detoxification of the brain doesn't just involve biochemical processes, but you have to have certain pipes that bring toxins out of the brain on an ongoing basis. And that's the lymphatic system. The lymphatic drainage of the brain works through the cribriform plate. Fluids are drained and then end up in the adenoid area, that's sort of back behind the nose, where the first place is where toxins are decomposed. That means they're digested to some degree in the adenoids. That's a group of lymph nodes that are excreting certain components into the mucus. Other components stay in, but it breaks toxins apart. Then it goes from there to the tonsils, which further digest the toxin. That means break them apart further. And from there it goes into the lymph channels that then dump into the big veins here. When you have a kid that has a facial deformity, like the jaw isn't properly developed, the upper jaw sits too far back, the teeth aren't developing properly, the facial features aren't proper, it's a narrow face with a high arch, from folic acid deficiency of the mom, often that is, then the lymph channels, these fine low pressure channels through which these toxins kind of are transported, are often kinked, like a garden hose that has a kink in it. And the fluids cannot drain properly. And it leads to a mechanical buildup of toxins in the system, even though all the enzymes, all the biochemistry works perfectly. But there is a structural component to drainage, to lymph drainage, which is overlooked by most people. Yeah? And fortunately we have a few dentists now who have recognized the importance of that and know how to open up the lymph drainage of the brain by putting dental appliances in these kids. Sometimes it's just as simple as putting a lower plastic splint on the lower teeth. Usually, by age 2, kids have teeth to work with. Dr. Robson here in Tacoma has developed a special appliance that pulls the lower jaw forward and opens the mouth and looks at the openness of the pharynx, of the larynx. So you optimize the flow of air that goes in the lung, and people get much higher oxygen levels, which has a strong effect on turning on the detox enzymes, plus decreasing infections in the body, plus activating the immune system. So there's a lot of secondary effects that are working against all the things that we identified so far as causes of autism, just simply by putting a dental splint in. So that was the next point. Now I have to kind of think what there's 2 missing ones.
We've done toxins, nutritional deficiencies, psycho-emotional issues, geopathic and electromagnetic stress, structural problems.
When we take a little break, we take a 5-minute bathroom break, and then we go into the other 2 points.
Okay. Very good.
I lecture on this thing every day.
No.
Then I'm completely blanking on.
What do you call these 7 things, Tom?
The 7 factors.
7 factors
Of health?
We used to call it the 7 factors of blocked regulation. That's how we
that's how I would.
Let me see, we got the emotional. Oh, the interference fields were still missing. That's one. Oh, and the food allergies. Okay, yeah. Why don't you switch it back on? We just.
Was the molecular pump separate than the electromagnetic stress?
The electromagnetic stress inhibits